The next discussion we're looking at is like a way of trying to treat infections of the joint. So if you have infections in the joint, there have been inflammation, there have been necrosis, alright, and there's not accumulation of pus. I see somebody commenting, Kalkul Dash. Good morning, bro. Good morning. From India, right? You see me, I keep my mustache like an Indian. Alright. So if there's accumulation of fluid in a pore, accumulation of fluid in a joint, right? Or there's pus, where it could be any fluid, right? But most of the times it's pus. Okay. So there's accumulation of pus in a joint, which is the most disturbing type of effusion. You don't really depend on only drugs to handle such a problem. You might actually want to put in your needle in that joint, then aspirate anything that is accumulating in that joint out. Okay, so you have needle aspiration. Then you can also have arthroscopic wash. You know, arthroscopy is that joint procedure. Okay, on the knees, on the shoulder. So they can use it to treat, they can use it to diagnose. You know, so let's look at these two. So both of them, looking at the needle aspiration and arthroscopic washouts, they are procedures used to drain or clear fluid, or it could be pus. Do you understand? From a joint. Do you understand? Often maybe there's a severe joint effusion, septic arthritis. Septic arthritis, there's a joint inflammation and all of that because there's like infections coming up. You know. So this is so the first one is the needle aspiration. Okay, yeah, this is needle aspiration. I have the picture here, the picture of needle aspiration. So for the needle aspiration, we said that you insert a sterile needle into the joint space, then you now withdraw the synovial fluid. Like there have been accumulation of fluid in the joint. So it has accumulated to a level that is causing a lot of pressure. So you understand? You now relieve the person of the pressure. Okay? So purpose can be used for diagnosis, that's fluid analysis. You check if there's infections, you check if there's crystals, you check if there's inflammation. Then therapeutic, to relieve the pressure, to relieve the pain, relieve the swellings. So advantage is very quick, it's very simple. Right? Can be repeated multiple times. It's performed at bedside or outpatient settings. Limitations may not fully clear out the infection or pus. So after you do the aspiration, you follow up with antibiotics, okay, and also those analgesics, non-steroidal anti-inflammatory drugs to reduce the inflammation. Now for the next one, which is arthroscopic wash. All right, I'm doing a procedure of arthroscopy, and basically I'm trying to put out everything that's inside there. All right, so it's a surgical procedure, and you are using an arthroscope. That's a camera instrument. You are trying to irrigate, you put in fluid into the joint, then draw it out. So this will wash the joint. So it can be used to remove pus, can be used to remove debris, infected tissue. Alright, then also, after you remove everything, you can now directly visualize the joint structures. Alright, so there's for this one, the advantages is there's a more thorough clearance of the infection, allows direct inspection of joint surfaces, can debride necrotic tissues. So limitation, it requires operating room and anesthesia, okay? And it's more invasive, it's more demanding, you know. So that's what we have for needle aspiration and arthroscopic washout.